Good morning, and thank you for having us. We are the Revilex team, and we are here to present our business plan to you this morning and ask you to award us the $25,000 first prize. My name is Meg Nash. I am the Chief Technology Officer for Revilex, and I am currently a full-time graduate student in the School of Engineering and Applied Science in the program for Emergency Management and Public Health.
Good morning. My name is Scott Nash. I'm the Chief Technology Officer for Revilex, and I'm a graduate student in the Cybersecurity program in the engineering school.
I first got involved in disaster preparedness and response in the early 90s. My mentor, who was the head of the latent fingerprinting department for the FBI, and I consulted on a project that would allow the FBI to bring together witness data, witness identification data after a transportation incident. Since then, I have been hooked.
In 2008, Meg and I designed and developed a mobile disaster network application for the first Android Developer Challenge. So you can see that we've been passionate about this for quite a long time. Today we're going to show you how Revilex is uniquely positioned to leverage cutting-edge technology to bring about the world's first disaster data collection system that will ultimately save time, money, and lives. I have over 19 years of professional experience in the software development and architecture arena, with specific expertise in big data, geographic information systems, and distributed computing.
In addition to my 13+ years of professional experience, mostly on the program management and business consulting side, I've been involved, as I said, in disaster response and emergency preparedness for quite some time. I was a first responder during college in our campus emergency team, as well as I'm currently a member of Loudoun County's Company 14 Volunteer Rescue and a member of the Department of Health for Virginia Medical Reserve Corps. You can imagine that in the event of a large-scale disaster or emergency, one of the most critical pieces to putting that investigation together is the witness recollection, those interviews that the agencies can do afterwards. Unfortunately, the more that a person recalls an event that they've experienced, the less accurate that grows. So one of the key pieces here is that eventually their recollection would be totally false. You can imagine, we've all played telephone as a kid, and you start off with one phrase and then you go to another, and by the end it's hysterical because it's nothing like it started. This is very much like that, because if you interviewed every person in that line of telephone, no one would remember changing what they heard to what they said, and that's exactly the same situation that we've got here. So being able to capture that initial recollection, that earliest recollection, and have that available for the investigators is going to improve accuracy dramatically. And then being able to share that among the agencies that are actually responding is going to be invaluable. So let's show you how this is going to work.
So the Revilex system is a series of components that all work together to collect disaster data at the scene of an event and disseminate that information to the people that need it most. The field unit here is capable of being delivered to the scene by a first responder. It's able to be transported by a single individual, carried or rolled, and it contains all of the elements that are needed for a collection of information. Tablets are located inside and are handed to survivors that are at the scene, and each tablet is preloaded with a series of interviews that collect information about what they witnessed, what they experienced, as well as how they're feeling, both emotionally and medically. The interview is presented to the individual in their native language. Once that information is collected in the unit, it is forwarded via secure wireless communication to the Revilex cloud, where big data algorithms will process and analyze the information to extract trends as well as the proverbial needle in a haystack. Investigating agencies have access in real time to the raw data through a custom API. Responders and healthcare providers can access the data either through the tablets that are part of the field unit, through a smartphone application, or through their existing patient care information systems.
Coordinators, like those that would be running an emergency operations center, or those that would be in the incident command will get a data feed of this. And what the coordinators are looking for are any patterns of symptoms across different treatment facilities. So if you have a mass casualty incident, we're all very familiar with some this week, patients are transported to multiple facilities. What this is looking for is if there is a potential for a biological or chemical event in conjunction with that, say in Boston, had there been something in one of the bombs, this would be monitoring syndromic surveillance and saying that we see this pattern of symptoms across all these treatment facilities. Right now, there's no mechanism to do that. That'll allow the coordinators to actually mitigate the effects much more quickly.
Revlex is positioned in the healthcare analytics market, which is one of the fastest growing markets, as you can see from the 24% annual growth over 5 years here. Currently in 2013, it's projected to be $4.6 billion.
And Revilex is the only system that is positioned to capture disaster medicine healthcare analytics. This is unbelievably important because in the event that there is a biological or chemical event that happens, we can't wait till 5 years out for a commission report to come out and say, oh, we really wish we had known what was going on. We really should have had the data. This needs to be on the scene. This needs to be installed now so that it's ready to go before that so we can mitigate those effects. It is timely and it is now. As far as the benefits of the Revilex system, Revilex saves time by providing faster access to better data and avoiding some of the redundancy from multiple agencies interviewing. Saves money by giving the big picture to everybody that's involved and allowing them to better prioritize their most critical resources. And it saves lives. We can facilitate faster responses from EMS and from medical providers. They can use better resources. If a facility knows that they've got 20 major surgical cases on the way, they may be able to divert their surgical case that is more minor and can wait rather than taking up the surgical suite at the time. And we'll be able to provide key disaster data management to everyone that's involved. As far as the timeline goes, we have a pilot program set up with GW Hospital for this summer that will allow us to test our first translation in the interviews and also be able to test the field unit itself. After that, we've actually recently found out that Brevard County is interested in being a test market for our system. So the chief of operations there in their hazmat unit is actually one of our advisors. And after that, you'll see that we've got 6 waves of installations. But over on the left, you can see that those are the metropolitan regions that we'll be targeting. These regions are indicated by Department of Homeland Security as being the 11 most likely high-risk areas. So over the next 3 years, we'll actually install 258 units of these throughout the United States, geographically distributed to these markets. That will cover 73 million Americans as residents. But if you look at the visitor population to these metropolitan areas, we're talking almost 325 million people. So this is a very large coverage system. The way we're going to accomplish this is the Business Plan Competition Award is critical. This will actually fund the pilot program, and this will allow us to move forward. Our investment advisor at Cooley in Reston has indicated that being able to raise a seed round for a program that is government-facing is very difficult if you don't have a system that's operational that they can actually see. So this is going to be our proof of concept to move on and be able to raise our seed round of investment of $500,000 anticipated later this year. That will pay for the hardware for our first round of installations that covers the National Capital Region and also give us the proof that we have an operational system in the market now to then raise our first round of investment of $2 million. That will help us buffer our operational expenses throughout while we're going through the federal budget cycle, which, as you know, can take a while sometimes, and also pay for the hardware required to do the entire first wave installation. And then after that, our system fees, data subscription fees, and maintenance will be enough to pay for our operations and keep us profitable throughout our operations. As you can see, our revenue stream is set up. We've got a one-time system setup fee and annual maintenance that will be directed at the Department of Homeland Security. This is to also get their buy-in and their commitment and give us their requirements to make sure that the system is meeting their needs as well. The data subscriptions will be targeted at investigational agencies, Department of Justice agencies, FBI, ATF. The list is extensive. as well as jurisdictions that may want to have access to that data. So if you've got like DC, DC's Homeland Security Emergency Management could get a subscription and be able to disseminate it to whoever they need to. We anticipate that next year we'll actually have enough data to understand different ways that we can categorize and package this data, and we anticipate that there will be additional data subscribers that could use this. But that'll be something we'll be able to determine later.
So we recognize that one of the best ways to be successful when selling into the government is through direct personal contact. So we expect to leverage our advisory board as well as our academic and professional contacts to establish relationships within our target agencies.
We have, since the business plan was submitted, we have identified a seasoned business development professional who has over 20 years of direct selling experience into the federal government, including experience with intelligence, that's interested in joining our team. So we're very excited about that. As far as brand recognition and awareness, keep in mind these are not going to be the people that are writing the check and selling it. They're going to be the people that need to champion it. We're going to be displaying at trade shows, specifically those that are designed to attract emergency managers and first responders. We'll be presenting original papers at appropriate conferences throughout the country. And as far as social media goes, since I'm in the field, I have an established network of social media contacts within disaster response, emergency response, and I intend to leverage those so that we can establish Revilex as a recognized thought leader in disaster data analytics. So here's where we get specific. The $25,000 business plan award is critical for this program to move forward. It will enable us to run the pilot program and get this system installed sooner rather than later. And I think we all can relate to events this week that this needs to happen, and this is how we're going to get there. As far as what the funds will go for, it will go to pay for the design and prototype of our case. This is one that exists. It'll be a little more specialized to our needs. Translation services, paying for the cloud infrastructure, the communications hardware, and everything that we'll need to actually be able to run that pilot program so we can move on with our installation. So, again, critical. As far as financials, we show solid growth through the first 3 years. At the end of 2016, keep in mind that we are just finishing our Tier 1 installation. At that point, we are going to have 258 units on the ground, and we're going to leverage those units being installed so move into additional intelligence capabilities and new verticals. The key is to have those units there. We'll also continue on with the Tier 2 and Tier 3 installations that will continue to cover more of the United States. With those additional capabilities, you'll see that our revenue is anticipated to be around $35 to $40 million at the end of year 5. One of the exciting things, since we actually published our business plan, is we have located a new hardware provider, meaning the production for the case. It will save us significant costs from what we originally anticipated, and you can see it really changes the picture. In 2014, we actually are profitable, even though we still need the investment to keep operations going. And then in 2016, we've got quite an increase in our net profit. Our board of advisors, as I mentioned, the district chief Scholmeyer from Brevard County is very interested in both advising and helping us run the test market. Dr. Pines, who is an emergency physician as well as a professor here, is going to be helping us run the pilot and advising on the medical content within. And then we also have the IT tech manager for the Red Cross and additional psychology and biochem terror. So I think today we have shown you that this is not only a timely system, but one that needs to happen, and we need your support for that. We've established that it is an established market. It's a hot market with a lot of growth. We are a highly qualified management team and incredibly passionate about this subject, and our board is very supportive and going to round that out. It's a highly scalable solution, and this business plan award is going to allow us to continue development of the system and let Revilex save time, money, and lives. Thank you.
We're going to take 5 minutes for questions from the judges. Speak up, Roger.
Tell me about the technology. So my impression, it's a forms-based technology, but you're using any kind of semantic clustering or parsing so that you can actually aggregate the data. Then once the data is collected, what analytics are you applying to it, and how does it get read?
I think you hit the ball right on the head there. The idea is that a number of machine learning, clustering, semantic analysis algorithms will be levied to it, and each one of those will be custom tailored to the agency's what they're looking for. So we're extracting certain things for different target agencies.
So one of the things when we get a data subscriber, we're anticipating that there will be a significant requirement session for us to understand what do they want this data to be able to do, what format do they want it in, and then those algorithms will be contained within the cloud. So the agencies specifically that will be doing the analysis will be able to access the raw data in real time, but then also get the access to the process data. Does that answer?
I got lots of questions, but I'll let others.
Okay. We'll give you our email address if you run out of time. Yes.
Yes. Hi. Well done. Certainly a very noble purpose, and I like that. My question is also related to the product. Probably not as sophisticated as the question as Roger, but you talk about at the beginning, early recollection is key to making better decisions to save lives, etc.
Right.
Then you talk about an example of it being very much survey-based, but your value proposition around healthcare. So you probably have other things in that box, in the solution, that have to do with healthcare. Can you talk about that a little bit more? Other than just the recollection of what happened at an event.
Sure.
Which is interview-based.
Right, and depending on what the nature of the event is. There is a triage component that will analyze, and it will go through as an expert system, go through and analyze and take data of what things are you experiencing, how, physically, medically. Are you having trouble breathing? Are you breathing too fast? Does it hurt to breathe in? Obviously, if it's a blatant injury, but generally in disasters like these, the blatant injuries are the ones that are easy to take care of. So that's one side for the triage management, and that is an expert system. So depending on how you answer that, the next question is going to change. It's not going to keep asking you the same question. And then from a recollection standpoint, if it is an event where there was an explosion, there was a derailment, it's going to ask questions specifically about that. And one of the things that we're most proud of is that as more information comes into the system, and as investigations say, okay, obviously now we know that this was an explosion, that can affect the survey structure. So it can now introduce, say, so did you hear something at this time? And it can do that in real time of if somebody's actually doing their survey. It can also come back, so if somebody has already filled out their survey, they can be contacted either directly. We have another mechanism where somebody can do this on a smartphone app, if we're not talking about medical, that they can actually enter their witness data. But they can be contacted back, or if they're still at the scene and get a tablet again, they'll be actually able to pull up their existing survey, and it'll say, we have some additional questions for you.
You mentioned, I guess it's by 2016, you'll have 258 units in place, and that'll be kind of the key point. Is there anything other than constraints from a capital standpoint, funding standpoint, that will constrain that growth, that acceleration? Is there any way to accelerate that, or is there any reason why you cannot?
Oh, no, absolutely. Originally, it was the hardware costs that were restricting how far we had to structure that. And since we've found the new hardware vendor, with the first round investment, we can actually condense that installation to about a year and a half. We can use that capital instead to condense that schedule. We didn't want to go too far from the original business plan and muddy the waters, but that is an accelerating factor.
Thank you very much.
Thank you.